Are you vitamin B3 deficient? Look out for these signs. Niacin or vitamin B3 comes in two forms, nicotinic acid and nicotinamide or niacinamide. This vitamin usually doesn't take center stage, but it actually plays a key role in many crucial processes in our body such as metabolism, heart health, cellular function, and even our skin health. In fact, vitamin B3 plays a key role in preventing pellagra, a condition characterized by 4 Ds: dermatitis, diarrhea, dementia, and death. Basically, pellagra emerged as a widespread epidemic in the 19th and early 20th century in the southeastern U.S. states, also known as the Pellagra Belt, and in Spain, Italy, Brazil, Argentina, African countries, and many Asian countries. It is estimated that pellagra caused over 7,000 deaths a year for several decades in the southern parts of the U.S. alone. Anyway, the actual cause of pellagra was not clear until Dr. Joseph Goldberger, along with other scientists, discovered a link between pellagra and niacin deficiency. So now we know that vitamin B3 deficiency can cause a number of health conditions, including deadly ones. But how can you tell if you are deficient in vitamin B3? Look for these signs that we are going to show you in today's video. Without any further delay, let's begin. 1. Fatigue and weakness. Do you often experience weakness, low energy, and feel like you're dragging yourself through the day? This can happen due to many reasons, including vitamin B3 deficiency. Niacin is part of the NAD coenzyme which is required for the production of adenosine triphosphate, which are tiny packets of energy that keep you going. Having vitamin B3 deficiency means that ATP synthesis is hampered, resulting in reduced energy levels. In simpler words, vitamin B3 helps convert food into energy. Without enough of it, you might feel weak and tired all the time. Before we move on, please take a moment to subscribe to the channel and hit the bell icon if you find our videos helpful. Please support us by becoming a patron. 2. Digestive issues. Vitamin B3 deficiency can lead to symptoms of digestive discomfort like nausea, vomiting, and diarrhea. This can be explained in many ways. For example, niacin helps our body make NAD coenzyme. Without enough of it, your intestinal cells might not function properly and inflammation could set in. This inflammation can lead to symptoms like abdominal pain, nausea, and vomiting. Vitamin B3 deficiency can affect your nervous system too. Your digestive system relies on signals from your nervous system to function correctly, also known as the gut-brain connection. When that is in short supply, these signals can get mixed up, potentially causing issues like nausea and diarrhea. So if you often experience these symptoms of digestive discomfort, you must consider the possibility of having vitamin B3 deficiency. 3. Skin problems. Remember that pellagra I told you about? Well, besides digestive issues, pellagra can also affect your skin. You might notice dark red patches on areas exposed to the sun like your hands and neck. This is known as pellagra dermatitis. Also, while the exact link isn't fully understood, studies show that vitamin B3 might help regulate oil production in your skin. If you're lacking in vitamin B3, your skin's oil balance can get seriously disturbed, leading to dry or flaky skin and irritation on your hands, face, and elbow. Plus, this dryness can also cause frequent acne and pimple breakouts. And surprisingly, niacin is used as an ingredient in many skin beauty products. Now you know why. 4. Cognitive difficulties. Niacin's role in energy production can easily explain this sign of vitamin B3 deficiency. Your brain is like a powerhouse that needs a lot of energy to function properly. Vitamin B3 helps convert the food you eat into energy that your brain can use. When B3 is in short supply, your brain might not get the energy it needs, making it difficult for you to concentrate. Another thing is that niacin also helps your body make neurotransmitters, the chemical messengers that allow your brain cells to communicate with each other. Vitamin B3 deficiency can affect mood regulation, memory, and cognitive function. It may lead to mood swings, depression, anxiety, memory issues, and brain fog. And by the way, dementia is one of the 4 Ds of signs and symptoms of pellagra, which means that in severe cases, niacin deficiency can even cause memory loss. Surprisingly, studies show that vitamin B3, particularly in the form of niacinamide, can positively affect cognitive function. It helps with mental clarity, focus, and overall cognitive performance. So if you often find it difficult to focus, remember things, and make decisions, these could be the signs that you are vitamin B3 deficient. Causes of vitamin B3 deficiency. Now let's see what are the most common causes of vitamin B3 deficiency. One of the primary reasons for vitamin B3 deficiency is a diet that lacks niacin-rich foods. In fact, most people who fell victim to pellagra were the ones who had corn-based foods as their primary diet. Corn is actually high in niacin, but that kind of niacin is strictly bound to the carbs in the corn, making it extremely difficult for our bodies to absorb it. And well, if you are a vegetarian or a vegan, then you may be at a higher risk of developing niacin deficiency. This is mainly because your body needs tryptophan to make niacin, and tryptophan usually comes from protein-rich foods like chicken, beef, turkey, fish, and eggs. So if you do not have these foods, you are very likely to develop vitamin B3 deficiency. Another potential cause of niacin deficiency is alcohol abuse. Alcohol has a tendency to interfere with the absorption of nutrients by your body, including niacin. Similarly, certain medical conditions like celiac disease, Crohn's disease, and other gastrointestinal issues can also hinder the absorption of vitamin B3 in your body, causing its deficiency. And lastly, certain medications such as the ones typically used for lowering cholesterol can also hamper niacin's absorption, or promote its excretion from the body. Diagnosing and treating vitamin B3 deficiency. The best way to check if you have a vitamin B3 deficiency is by visiting your healthcare professional. They can run blood tests and assess your symptoms to determine if vitamin B3 deficiency is the culprit. Sometimes, a simple change in diet can help. Your health expert may also recommend niacin supplements according to your condition and your specific needs. As for dietary sources of niacin, you can consider having more animal-based products in your daily diet like the ones I named before. And if you are a vegan or vegetarian, no worries because there are many plant-based sources of tryptophan such as soybeans, chickpeas, almonds, peanuts, walnuts, tofu, pumpkin seeds, whole grains, and dark chocolate. Another option is to take niacin supplements. Niacin or vitamin B3 supplements come in mainly 2 forms. The first one is nicotinic acid. This one is commonly used to treat high cholesterol levels. It can cause a flushing sensation, a temporary side effect characterized by redness and warmth of the skin. Some modern versions of this supplement can also help reduce flushing. The second one is niacinamide, also known as nicotinamide. This form of niacin doesn't cause flushing and is often used in skincare products for its potential benefits on skin health. For managing cholesterol levels, higher doses of nicotinic acid are often used. Starting doses might range from 500 to 1,000 milligrams per day with a stepwise increase under medical supervision. Consult a certified healthcare professional for the recommended dose of niacin. Some skincare foundations contain niacinamide, which is a form of vitamin B3, in concentrations of 2 to 10% for skin benefits. Recommended daily intake. As for the recommended daily intake of niacin, an average adult man needs about 60 milligrams of niacin daily, while a woman needs about 14 milligrams of niacin daily. So I hope now you know which signs to look for if you think you have a vitamin B3 deficiency and what to do if you notice these signs of niacin deficiency. Thank you for watching and subscribing to the channel. See you in the next video.